Well, I'd like to go ahead and get started and welcome everybody. Good evening. Good evening. I hope you all had a wonderful day. Thank you so much for spending time with us this evening. We are really excited that so many of you chose to attend this event. My name is Dana Harvey. I am the president of Verve360 Media and the communications consultant for SEMPQIC. So obviously, because you decided to join us tonight, and you're here and spending the evening with us, you have some concern and care about the health of Black women and our babies. So thank you for joining us to the film screening and panel discussion for Toxic, a Black Woman's Story. I would like to introduce the SEMPQIC, the Southeast Michigan Perinatal Quality Improvement Coalition leadership. We have Vernice Davis-Anthony, Alethea Carr, Dr. Iris Taylor, and Lisa Braddix. In addition to the leadership team, there's an additional group of people, a small but mighty team. They include Karen Schrock, who is the manager of one of their major grants, and Andrell Sturdivant, she is the community liaison, and Devon Parrott, who is our support and technical coordinator. So moving forward, I'd like to introduce you to the panelists. We'll get into discussion following the film. Again, we have Vernice Davis-Anthony, who will be on the panel with, representing SEMPQIC. We also have Dr. Monica Lee-Griffith, who is the Vice Chairperson of Women's Health Services at Henry Ford Medical Group and the Director of Obstetrics at Henry Ford Hospital. We also have Robena Hill. She is our lead home visitor and community-based doula with Black Mothers Breastfeeding Association, and I will be serving as your moderator, excuse me. So I wanted to let you all know, some of you may have seen this film before, but you're really in for a treat, and that means educating and being informed on a serious critical issue that SEMPQIC and many others are working on. You may come to a few aha moments, and I'm sure you'll appreciate what we're going to show you through the film. So just so you know, Toxic is a Black woman's story and explores the day in the life of Nina. Now, Nina is a professional African-American woman. She's in her second trimester of pregnancy, and she's an archetype for thousands of Black women who are experiencing infant loss. So this film explores multiple inequities beneath infant mortality rates, and it also uncovers the microaggressions and multi-layered experiences that are unique to the African-American experience. So this is a film that also has an intent. And what SEMPQIC wanted you to know is there are a few goals that they wanted to ensure that are addressed and received during this screening. So the first one is to raise awareness of the impacts of structural racism on the health outcomes of Black babies and Black women and babies. The second one, we want to change the narrative from negative myths about Black women mortality to more of a results-focused conversation. And the third one, we want to help participants who are here with us this evening understand what role they can play. So those are the goals, and we hope that we can achieve those through this screening. So before we show the film, there are a couple things we want you to think about while you're watching. So just keep in mind as you are taking in a day in the life of Nina. So the first one, what are some of the stressors that Black pregnant working women face? Nina will share hers, but I also want you to pay attention as she progresses through her day. The second one, what are some of the indicators of systemic racism that you noticed in the film? And the third, what are some of the strengths that you noticed in Nina and her family? So we have the chat that's available. We would love for you to engage with questions, comments. We have some of our team inside the chat who are going to be posing questions and engaging with you. And we really want you to just pay attention, take it all in, and be mindful of what Nina is facing and the information that's going to be shared. So if you have any questions or comments, please feel free to share them. And the film is about 25 minutes long. So following the film, we'll get into the panel discussion and hopefully have a few minutes for questions. There's about 300 people with us this evening, so we won't be able to get to all of them, but we do want to hear what you think, what you're feeling, and any questions that you think are pertinent for the panelists or what the team can address to you later on. So I think we can move forward with starting the film. So I wanted to give everybody a few minutes to think about, take in, and reflect on what we just watched in this film. So before we move into the panel discussion, let's just take a few minutes, and I want to pose a few questions, I want to give you a few things to think about, some things to reflect on. The first, what are some of the daily stressors that Black pregnant working women face? Please feel free to add those to the chat. Just, take some time to think about what those are, especially Nina. Also, what are some of the inequities addressed in the film? There were many, all in just one day, but think about those. I see a lot of comments coming through, a lot of them. So I know that you guys felt what Nina was feeling as you were watching. We also want to know, what do you think some of the indicators of structural racism are that you noticed? So not only what Nina was dealing with as it relates to her birth journey, but just in all the other facets of life that she faced on this one single day. And the last one, just give this some thought, as we move forward and learn a little bit more about what our panelists are going to share with us. But what can you as an individual or your organization do to address structural racism? So just take a few minutes. Oh my goodness, there's so many comments in the chat. I know that our team is monitoring those, and it looks like there are a lot of people who have some feelings about what they witnessed, and they'll be sharing some of those comments. Some of them that we've been seeing, worrying about the job, microaggressions, work stress, the doctor, the spouse, anxiety, discrimination. So I'd like to go ahead and get started with our panelists. If I can have everybody turn your screens back on. With Vern, Dr. Lee, and Robena, if you guys can unmute yourselves, we definitely need to hear what you have to say this evening. So again, wanted to reintroduce our panelists. Vern Anthony, she is the CEO of VDA Health Connect and a consultant with SEMPQIC. Dr. Monica Lee-Griffith, Women's Health Services, Henry Ford Medical Group, and Director of Obstetrics from Henry Ford Hospital. And Robena Hill, the community-based doula and lead home visitor with Black Mothers Breastfeeding Association. Thank you, ladies, for being here. I think we're gonna stop the screen share so we can see all of us at one time. So I know that you all have seen this film many times, but tonight I wanted you to share from a professional perspective how you felt about what you saw in the film and how it relates to the work that you're doing. So I think, Vern, you're going to start off with what SEMPQIC is and what inspired the organization to host this film.
Okay. Again, welcome. Thank you, Dana. I've seen this film many times, and every time I see it, it grabs me. I mean, I can barely keep from crying. You put yourself in that position. We're also going to talk about maternal mortality. And I almost lost one of my daughters during her delivery. It was the worst feeling in the whole world. She lived through that, and that was a blessing. But I never lost a baby, but I know many people that have, and based on the comments, I know that there are people with us this evening who have lost a baby, and that pain and that loss really, really goes very, very deep. So I'm going to share some statistics, but I think you will know that the data that I share is not just numbers. I mean, these are real people, real mothers and families that had the loss. But first, for those of you that don't know, I'll tell you what Southeast Michigan Perinatal Quality Improvement Coalition is, called SEMPQIC. We are collaborative. We represent 3 counties in Southeast Michigan. There are 10 regional collaboratives in the state of Michigan. And actually we're number 10. And the counties that we represent, Wayne, Oakland, and Macomb, covers about 4 million people. The population is about 4 million combined. We also have in our region, 80% of Black births are in Southeast Michigan, and 75% of those are actually in Detroit. That's in Southeast Michigan. And I think I said we have about 80% of the births, actually. So what we do here makes a huge difference. We drive the state when we're doing great, and the whole state suffers when we're not. We are funded by the state of Michigan, along with the other regional collaboratives in the state, our primary funder. We've been in existence now for 5 years. We also have other funders, Kellogg Foundation, for example, the Merck Foundation, as well as from time to time other funders. As you've met our team, so you know we're very small in number. But our membership, we have about, we'll throw out a number, one of you guys can correct me if you want, but we probably have about maybe 40 or 50 different organizations that participate regularly in SEMPQIC. At our meetings, we usually have close to 100. We meet once a quarter. A lot of work going on between that time. And SEMPQIC as an organization is no better, cannot be better than our membership. Our membership does the work. So any progress that we make, we have to thank our membership for their active participation. So that's who SEMPQIC is. Our mission is to develop a perinatal system of care in our region that results in reducing the disparity between Black and white births. We've had this disparity between Black and white births, as well as maternal mortality for some time, and I will get into some numbers around that. But that has been our mission from day one. So if we could start with some slides, Devon, if you could put up a couple, and I know everybody in the audience is not a healthcare professional or scientist, but data does help us understand the severity of the issue, as well as where we're headed. This first chart compares the infant mortality rates by maternal race in Region 10. And you can see, just by looking at the length of the bars, that the Black one, and that's the second bar there, is the highest, 13.9 versus the white rate, which is 4.7. So the disparity there is almost 3 times the number of Black babies die than white babies. And this is from 2015 to 2019. Sometimes, well, we know when you have smaller numbers, you kind of do like a rolling average so you can get the real impact, because any single year, could be an aberration or up and down. So, so that's how we measure it. The Hispanic births a little bit higher than white births. We don't have enough Native Americans in our area to give you that number. And the Asian Pacific Islanders actually have the lowest infant mortality rate, even lower than the white population. But again, if you look at the numbers, I think it said 591 Black babies died. 970, I'm sorry. 970 Black babies died during this period of time, almost 1,000 babies. A couple of quick definitions. Infant mortality is defined as the death of a baby before that very precious first birthday. When you're on Facebook and you look at the first birthdays and parents are happy, the baby's smashing its face in a cake, such a festive occasion. But we're talking about all the little angels that did not live until their first birthday. And that's a very sad statistic for the Black population. Infant mortality rate, this is the one we did. Next chart, if you will. This is a graph which shows the infant mortality rate for Black and white. The white infant mortality rate is the very low line at the bottom. And as you can see, this is from 2005 to 2019. It's low, it moves a little bit, but it stays down. The Black infant mortality rate is the orange bar. And you can see how high that is. And that's what tells us what the disparities is between Black and white births. And the yellow line at the top is how we measure disparity. We do have some good news in this, in that the Black infant mortality rate for Michigan went down between 2018, 2019. We just got the 2019 numbers, but it's still twice that, more than twice that of the white infant mortality rate. So we're looking at that disparity and trying to make a difference here. Next chart. Okay, this is a maternal mortality. And maternal mortality is defined as deaths of the mother during pregnancy, at delivery, or within 1 year of pregnancy. So that's during the pregnancy, not just at delivery, but also within 1 year of delivery, based on anything that was related to the pregnancy. I mean, it doesn't include like car accidents and things of that nature. This should be shocking. You should be shocked. You should be shocked that the Black maternal death rate is more than twice that. This is Michigan, but this is a national phenomenon. It's not just Michigan. It's a national problem that Black women are dying in some states up to 2 or 3 times, 3 or more times than white women. And we also know that at least 60% of maternal deaths are preventable. Doesn't have to happen. 60% of women who die from maternal mortality, those deaths could have been prevented. And you obviously saw some of that in the film. There are things that can be done in terms of quality and prevention that are just not done enough for Black mothers. So we can make a difference here, folks. So we're so glad that you're here with us. Next slide, Devon. This is the infant mortality rate for the city of Detroit only. And making progress. but look at our progress between 2018 and 2019. And we really want to recognize the city and all of the folks, many of you who are on this video, for the work that you've done and that we've done as a community to show us this decrease. I have to admit, though, that there's a lot of information that we don't have yet about what helped us make this improvement in Black infant mortality. It's still twice that of white infant mortality. So the disparity did not go away, but we want to recognize progress because so many of us have been working so hard, me for my entire career on reducing infant mortality. And when we see this for the city of Detroit, the city of Detroit is about 80% African-American. So we know that most of these were Black infants whose lives were saved. So this tells us that we really can make a difference. This is not a hopeless mission. It's not a hopeless cause, that we're working on. Want to move to the next slide. So again, just looking at the numbers here, you can see between 2018 and 2019, 55 babies in Detroit did not die. And that's huge. That's progress. But again, we still have twice as many Black babies dying as white babies. But we want to recognize our progress because we don't want you or people that are working with us to feel that this is hopeless because the statistics are so bad. We can change the numbers. We can change the numbers. If we can do this, we can also make an impact on maternal mortality. Someone asked, and I'm not going to answer this in detail right now, the general breakdown for cause of maternal mortality. I'm going to ask one of our experts online I know Dawn is here, and to go on and identify those areas. Sometimes it relates to the placenta. It's almost always, not almost always, frequently related to the condition of the mother prior to pregnancy and prior to the delivery. Conditions, diabetes is one. Obesity happens to be another one. And there are several others that hypertension really contributes to the death of a mother during delivery. And everything I said is preventable and treatable. Is this my last slide, or did I have one more?
That's your last slide.
Okay, well, again, thank you for coming. I'm gonna keep quiet so we can hear from our other panelists, but we just wanted to set the stage and just take a little time to look at some numbers. But there's a face, a baby, a mother behind every single one of those mothers. And we did see the experience of Nina. So,
Thank you, Vern. Thank you.
Dana.
I wanted to talk to Dr. Lee-Griffith a little bit about, taking in those numbers and understanding what statistically we're faced with, but also personally from a physician's perspective, reflecting back on the film, what do you think the provider, could have done, or what needs to be done on the part of the provider to, prevent Nina's situation from happening?
No, thank you, Dana, and thank you to SEMPQIC and Ms. Anthony for inviting me to this panel. For folks to know, this is only my second time seeing this video, and I'm glad I turned my camera off because it is emotional. It's emotional for me as a Black mother. It's emotional for me as a provider in the city of Detroit and as a healthcare leader within my department. There's a lot to unpack in the video, right? And I think for me, one of the messages I wanted to give the audience is we got to listen to our patients as providers. We have to listen to them, and we have to not ignore when they have concerns. In fact, we don't just need to listen to them, we need to ask them, do you have any questions, and what are those questions? And we need to have shared decision-making and when we're making care plans so that the provider and the patient is on the same page. And there were so many examples of how that wasn't done with Nina in the video. And so I wanted to make that very clear that we need to do a better job of listening. In terms of other things that I saw, there were a ton of microaggressions, as people said. I started taking notes. I actually, the second time seeing it, I found some ones that I didn't see the first time. And microaggressions and macroaggressions absolutely impact health and health outcomes. There's a lot of emerging literature on this. And so Black women face micro and macroaggressions on a regular basis outside of work in their home watching television. And so it was disheartening all that I saw that she experienced in a 24-hour period. As a provider, I would also recommend, outside of listening to patients, is making sure that we are following evidence-based practices for all patients all the time, right? There shouldn't be unexplained variation in the care we provide our patients. They should be the same type of care. It may need to be individualized, but it needs to be the same type of care for all patients all the time. I think it's important that providers and healthcare institutions and hospitals be involved in state quality initiatives like Michigan AIM and OBI. I know our SEMPQIC members are familiar with those. Those initiatives promote the use of checklists and algorithms and care bundles like those for hypertension or hemorrhage. And they help us have interventions that help guide our care to make sure that it's safe, of high quality, and equitable. I mean, that's the bottom line. So these quality initiatives are really important, and they've become much more important over the last several years for many hospitals in our state and across the country. I think a lot of the microaggressions that we saw were based on bias. And I think it's really important to address the importance of implicit bias education for all healthcare providers and team members. People may be familiar with Governor Whitmer's executive order from last summer that is going to require implicit bias education and training for licensed healthcare professionals. It's probably going to take some time before that mandate happens. I would probably say at least 2 to 3 years. But in the interim, I think people need to seek out implicit bias education and training. We all have biases, all of us. And the only way we can help mitigate those biases is to become aware of them and work towards decreasing them so we can improve health equity. And I think lastly, I would tell providers that are here, and that means any healthcare team members, right, is that it's important to diversify your environment. We need to diversify who is taking care of patients. There's many studies that show that the care quality is improved the more diverse the institution. So whatever we can do for the folks that are on this webinar to promote that, I think that's hugely important and frankly undervalued.
Thank you, Dr. Lee. I'm going to go to Robena now, just to address a few questions from her perspective of service of care. And I definitely want to come back to you after those questions are answered and just talk a little bit about what does it look from the patient side in the communication process through receiving care from a provider from your perspective. So I'll come back to you with a question on that. Robena, thank you so much for joining us. We had a great discussion with you earlier, and we know how passionate you are about the service and the providing of care to women. So I want you to kind of level set what a doula is. You know, many of us have heard it or may not have, you know, it varies, but tell us what exactly is a doula and what's the difference between a community doula and a hospital doula? And then I want to get your perspective on, had she had one, had Nina had a doula, how may her experience have been different? So let us know from your perspective what a doula does and how women can benefit from having one.
Definitely. Thank you so much for having me today. What a doula is, a community-based doula are trained, they're community birth workers who provide cultural, appropriate, non-clinical, emotional, physical, and informational support before, during, and after birth. As far as, I'm so sorry about my background.
No,
The
it's
neighbors are
nice.
getting they're getting their grass cut, and I was praying that they would be done by now. But the difference between a hospital doula and a community-based doula, the hospital doulas are just there for birth, to my knowledge. The community-based doulas at BENFA, we do 10 visits before mom goes into labor to educate her, to get to know her, and not just mom and family. And then also we're there at birth. So they're comfortable with us. When we come to the hospital, they're very comfortable with us because they did those 10 visits. And we got to know each other much better while I was educating the family and the mother. And then we're there after birth. We're there for 10 more visits. So they have us up to 3 months. So those are the difference between a community-based doula and a hospital doula. And in this situation, what a doula could have done, what a doula could have did with mother is educate mother, help mother advocate for herself. And also we are able to come before COVID, we are able to go to doctor's appointments with mothers. If the doctor is not listening to mother, oh, I'm going to ask those questions if mama don't ask those questions. And we also give mommy a provider guide. Our lovely boss created a guide to choose a provider. And if you see like the provider is answering these questions the way you don't like it, you have to go into another provider. You know, and we help moms in every way that we can, educate them, teaching them how to advocate for themselves, even educating them on different things that they're not aware of. We create a birthing plan and we give them a birthing plan to go over where they can take from and they can add to it. And we go over different things that they may not be aware of. And we make sure that they are aware of different things. So when they go see their doctor, they can ask all these wonderful questions, and then they can come back to us and let us know how the doctor visit went. And maybe some things that they did not understand that the doctor may have not broken down to them and just told them the medical term. And they was like, what is that? Then we're able to do some research with them and try to help them better understand what's going on with their body. And the main thing is that we can be right there holding their hand at their doctor's appointments. That's something that I cannot wait to COVID leave us so we can get back in the field and help our families. Even with COVID, we're still able to give them resources, give them information, make sure they're asking their doctors questions, make sure that they're going over their birthing plan with their doctor so they could be on the same page. And a lot of times if mother is not happy with their doctor or their midwife, we tell them, okay, it's never too late. It's never too late to switch over and get a different doctor or OBGYN.
So I felt your passion. I feel your passion. And when we talked before, we asked you about sharing a story of someone that you worked with, a personal experience with a mother. If you can kind of give us an idea of a personal experience and how that translated into a wonderful birth journey for this particular mother. So if you wouldn't mind.
No, I do not mind at all. Like I told you before, I'm gonna try to tell this story without crying. One of the stories that when you asked me that question that popped in my mind is one family that I love dearly with all my heart. That's family now. This is my family. I have had a mom who sadly lost the baby to sudden infant death. And it was because of the lack of the education from the spouse, which was a new spouse who, was not around when I was educating mom during the time of her pregnancy. Sadly, mother did lose her baby to sudden infant death. The organization and I stayed by mom's side, made sure the baby had a proper burial, made sure that we lay baby to rest, and just a proper burial. Also, we stick with the mother. We stayed by her side. I checked on her when mother was going through depression, different things like that. I helped her try to find a psychologist, find someone to talk to reach out to get some help. I still stay with mother. Mother became pregnant again. Mother said, oh, you gotta be my doula. I said, okay, here I am. I'm here by your side. I'm not going anywhere. Mother had a beautiful baby and a beautiful baby boy who is about 6 months old now. And mother and baby is doing fine. The family is doing fine. Mommy does have hard times. She does break down from every now and then about the loss of her child, which any mother would do. But the baby her second birthday was just the other day. And I do what I do. I check up on mama. How you doing? I know today may be a little rough for you. How's things going? And she actually said, today I'm at peace. And I was shocked. I was so happy to hear that, she said, I didn't cry at all today, and I'm at peace, and I know my baby is at peace. So I know that my job was done, but my heart was at ease knowing that mother was at ease and she was at peace with her baby being deceased, because it was very hard for her. And I understand. And it actually felt like it was my child when baby died. That's the bond that I have with my families. And I prayed with mom. I did everything that I could just to make sure mom is okay. And when she says she's at peace, I'm still gonna check on mama. That's just what I do. We are done with our services, but mom is family. And she's not never going anywhere. And she knows she can call me for anything and everything. And I'm just so happy. She said, I didn't cry today. I'm at peace. And so I'm happy that she's at peace.
I see a lot of comments that are happy about your passion and what you do, and how you touch these women's lives. So thank you. I see that all. I'm seeing that again. Thank you. So just hearing how a doula can advocate for a mother during her birth journey. And I wanted to bring this question back to you, Dr. Lee. And you, because you mentioned, from a provider's perspective, how important it is to listen. What is it in an interaction with a patient that might be missed? Or how can a woman, in your perspective, advocate a little bit better or more? Or what do they need to do to get a physician who may not be listening to hear her?
Yeah, thank you for the question. First of all, Robena, I want you to be my doula, but there's no way I'm going to get pregnant again. But I can tell you that I'm always excited when I'm involved in a delivery with a doula, because they provide such necessary support and outside eyes to what's happening. They're knowledgeable. The client or our patients trust them, right? And they're a valued part, in my mind, of the healthcare team. So thank you for all that you're doing. Someone did ask the difference between a doula and a midwife. A midwife is a healthcare provider, and we work with midwives side by side at Henry Ford Hospital all the time. We also work with doulas, and even in the midst of COVID, just so you know, Robena, we absolutely allow a support person and a doula. So if you have any clients that are delivering at Henry Ford Hospital, you are welcome to join us. We want you to be there. For patients, I think it's important, just as I mentioned, providers need to listen. Patients need to ask questions, and they need to keep asking questions. And you can ask the same question to different people to make sure you're getting the same answer. You just should. And if you're not getting your answers that you want or feel are satisfactory, you can escalate your concern. So if you're asking questions, you're not getting answers that you're comfortable with, or you feel like you're being ignored, escalate it. You can ask to speak to the head nurse. You can ask to speak to the medical director. You can ask to speak to the chief medical officer. You can escalate it to a care experience team member and let them know what's going on with you in real time. And we've seen that, and I've dealt with that in real time. You can also file a complaint or a formal grievance with the hospital. We do surveys, and you can fill out a survey afterwards about your care, and you can be very specific. I look at all surveys. I deal with all complaints and grievances. I talk to patients, and a couple people have asked about holding people accountable. I'm in a position where I can do that because I am a healthcare leader and director of the unit, and I'm passionate about the care we provide to all of our patients, but I have a specific interest in health equity and healthcare disparity, and which is why I've been involved with SEMPQIC for the past 5 years. Patients, also need to understand that they have to educate themselves, right? And so it's important that they do their background work. There's a lot of information out there. There's reputable websites. I think we are going to talk about the CDC Hear Her campaign. There's literature for providers, patients, and family members on that are really important. They need to educate themselves about urgent maternal warning signs, including chest pain or abdominal pain, bleeding, things where they should seek care. And there's resources providers also on that CDC website for the Hear Her campaign. I think it's also important that patients realize they need to let folks know that they are pregnant or were pregnant. So if you seek care in the emergency department after you deliver, it's really important for you to tell the care team that I've been pregnant within the past 12 months. Maternal mortality happens in all phases of pregnancy and delivery and postpartum. And quite frankly, more than 50% of maternal death happens in the postpartum period. And they can be related to the pregnancy or associated with the pregnancy. So it's really important that you let people know that you were pregnant, so there's a heightened awareness of what your risk could be. And I think lastly, it's important to ask your healthcare team member, have you been trained in unconscious bias? Not everybody even knows what that is. And so that's really, really important. At Henry Ford Hospital, all of our team members were recently trained in implicit bias education, and it's not a one and done type of thing. You need repetitive training to mitigate the biases that we all have. And so I think it's important that you ask your healthcare provider about that. And to Robena's point, if you're unhappy with your care, seek care elsewhere, either with a different provider or a different health institution. Give them a chance to make it right. But if you feel uncomfortable and you feel like you're being dismissed, there are other people that can take great care of you. And so that whether that's a midwife or whether that's a physician, whether that's a nurse practitioner, it really doesn't matter. It's about being heard, respected, and being knowledgeable.
Dr. Lee, I wanted to ask you, in a situation where a woman may have experienced a preventable situation or loss of a baby or issue with her, is there a way to hold health systems accountable for that bias? I know that you're working very closely with, the training of it, but what can a woman do if she has experienced that? What are the first, second, and third steps that you would recommend that she do? That she take?
I think, sometimes it's hard to tell if your care was not optimal because of bias or because of skill or because of communication, but I think bias impacts all of the care we receive. Ultimately, if you feel that your care wasn't good, no matter whether it was an outcome or respect issue or care delivery issue, you need to bring that to the attention of leadership. You can do that via email, you can do that via survey, you can do it via phone call. I've received them all. And I meet with team members when there's an issue. And things can go on providers' files that there was an issue, and people can put on performance improvement plans. Ultimately, the problem with implicit bias is that it is unconscious. People don't know that they have the biases that they have. And there's absolutely nothing wrong with bringing that to their attention. Well, Dr. So-and-so, you asked me this. Can I ask why you're asking me this? Why are you highlighting to me this particular issue? Is it because I'm African American? I've done it myself as a patient. About 80% of what Nina has experienced in that video, I've personally experienced myself, maybe even more than 80%, which is why it's so difficult. And when I go seek care with a physician or a nurse practitioner, whoever that is, I don't lead with I'm a physician. And so oftentimes I'm keenly aware of what's happening because I'm in the healthcare system. So escalate the concern, file a complaint if you need to, make sure you are being heard.
Dana,
Yes.
this is a good opportunity to mention, because it really falls right in line with Dr. Lee just mentioned, that the problems that we face as African American women does not relate to our income or education. And that has been one of the myths. That is poor women, that they didn't go to college or they can't talk. But that is not the case. Dr. Lee herself is a physician. I'm a nurse, and I had an appointment a couple of months ago, and the doctor tried to get up and leave 3 times. And I wasn't finished asking him questions. I persisted. He sat back down, and I had to do that 3 times because he was in such a hurry. And we know, for example, that Black women who suffer from, say, infant mortality, with a college education, still have higher rates of infant mortality than white women who didn't even graduate from high school. Didn't even graduate. So it's not that we're not educated or that we can't talk. I do think somebody on the chat wrote, we need to not be afraid of the people in white coats. And that is true. And that's why things like a doula can really be helpful, because somebody's got your back. Even if you have a husband or a mate, you could still, just knowing that somebody's got your back. And often we are afraid to complain because we think we'll get less care. If I let him know or her know that I was not satisfied, then I'm going to get even less care. You know, I might have to look somewhere else. So that's why a doula, midwives are particularly good also. Don't want to leave out the wife, the support that you would get from a midwife, but certainly the empower. One of our goals is to help empower Black women. Dr. Lee mentioned the Hear Her campaign, and we're going to give you the link. That's a CDC campaign that gives you information and resources that you can use on helping to empower Black women. Black Mothers Breastfeeding Association, as Robena mentioned, is already producing material that you as a doula can use or you can share with your client to give them sometimes you have to tell people the exact questions they should ask. If you don't know what to ask, just read this and be sure, don't leave if your blood pressure hasn't been taken, for example, because you know you're hypertensive. Don't leave until you ask about your prescriptions and know what you're taking. So transferring some of all this to empowerment is really one of our goals that we're talking about here. And that includes professional women.
Yeah, Vernice.
Robena, if you wouldn't mind. I'm sorry, Dr. Lee, go ahead.
No, I was just going to piggyback on that because she's absolutely right. I can tell you, and I only have experience again at Henry Ford, but when you complain about your care, it is taken seriously, and the care actually tends to be improved if it wasn't as good as it was, or at least we explain and apologize for whatever gaps there were. So it's not like folks, you have a meal at a restaurant and you're afraid if you complain, something's going to happen with your meal. I would encourage people to absolutely speak up. And it may not even be formed as a complaint. It may be a concern. Hey, you said this, doctor, and I really want to understand this a little bit more. I think we as providers can do a much better job, despite time pressures, of answering questions and encouraging questions. At Henry Ford, we round as a team, so everybody meets the healthcare team members. So folks that you don't know just run into your room, you've never seen them before. I ask regularly whatever support persons are in the room if they have any questions. And I think it's important, and I think Miss Anthony commented on this, is that, and so did Miss Hill to a certain extent, is that it's hard to advocate for yourself when you're a patient, right? It's just difficult. You're in pain, you're dealing with a healthcare issue. It's very difficult. So if you can have somebody by your side that can help you ask the appropriate questions and take notes if you need to. Take notes. I have no problem when people are taking notes. I actually like it because they can reference it. So take notes if you need to, ask a bunch of questions, and make sure you're aligned on the same page and moving in the same direction. There's nothing wrong with that. And in fact, that's what should happen.
So Robena, this empowerment is a lot of what you do. And, if you can just share, from your perspective, how you ensure that your mothers are empowered, in addition to you physically being there and advocating for them, how do you assist them in ensuring that they're asking the right questions? I also want you to address how people can find a doula or afford a doula. There's a couple questions in the chat asking about that as well.
Okay. For your first question, I'm sorry, could you tell me the first question again?
From your perspective, how do you ensure that the mothers and their partners and their families are educated and informed so that they can advocate for themselves?
So right now, during COVID, we're doing everything virtually. And so I encourage the mother to have her support system. I always tell the mother, it's always good to get you a support system. And I'm here to educate mom and family. So if you have your support system, they're able to advocate for you. And sometimes pregnancy brain is real. Mom may forget to ask those questions. I say, put it in your notes in your phone or take a notebook. Because if you have that notebook, you're not going to forget to ask because that notebook is in your hand. Our phones are always in our hands, so we do forget to ask a lot. But if you have their support person there with you, they maybe be able to encourage you to ask those type of questions. Also, even like I know you were speaking earlier, it's good that sometimes we have support as far as the spouse or the grandmother, but they may not know to ask those questions. And that's why the doula is so important. We educate you and we say, okay, well, that's not right. If you're feeling pain, go to the hospital. If your doctor is brushing you off, let's switch doctors. Let them know that this pain is excruciating. It's not just a round ligament pain or something like that. You know, I definitely encourage my families to ask all the questions that they can ask. I definitely ask them to please get them a support system, even with breastfeeding. If you have a support system, you're going to have a good breastfeeding journey. And if you have those people who are like, oh, just get a baby some formula, you're just going to get a baby formula. You know, it all starts with a support system and then having that community support from BEFA and from your doula to be able to help you navigate and ask those different questions and how you can get a doula. Well, for mothers that stay in Detroit, Hamtramck, and Highland Park, our services are free. We do have a waiting list, and you can contact us at BEFA. I'm sorry, I don't have the number right in front of me. I think it's maybe on one of the slides I gave you.
We'll make sure to put it in the chat and share it with everybody.
Okay, yes, and you can just Google us and you can fill out a form online and it goes straight to my email. We put you on our waiting list and we give you a call and let you know if we're able to take you. But like I said, our services are free for Detroit, Hamtramck, and Highland Park mothers.
So we are running close to 8 p.m. and this conversation from the chat to the comments to panelist information could go on for hours. There's so much information that can be shared. And I guess if there's something else, another question or comment or something from the chat that I could answer or pose, I'll just keep paying attention. But could each of you just, wrap up a little bit, your thoughts on, where and how you can make a difference and how the people who are watching this can make a difference? How can they help engage and empower themselves or their community? So, whatever your final thoughts are, moving on after these comments, Vern is going to get into a couple of call to actions so that everybody is literally walking away with specifics on how they can be activated, engaged, educated, and informed. So just really quickly, your final thoughts.
I can go ahead. The way that the community can help is definitely share resources. If you have resources, share them. You never know who you can help with resources. And hold someone's hand. A lot of times women don't even know that, like at Black Mother Breastfeeding Association, we have a breastfeeding club every Wednesday, virtually every Wednesday. And we come together, we help each other out. We share thoughts, we share experiences, we educate each other. And it's a mom-led program. So moms come, they talk about whatever they like to talk about. We meet new friends. And I started out as a pregnant mother going to Black Mother Breastfeeding Club. I was blessed with a free doula. And I mean, it changed my world. I breastfed my baby for 2.5 years. I didn't do that with my first two. I didn't breastfeed at all until I had my last son, who was 3 years old, very smart, and breastfed for 2.5 years. So what the community can do is definitely share those resources. If you know of something that may be able to help a pregnant woman, a good doctor, a good app, we talked about the Earth app, where you can find different good doctors and different resources and things like that. So definitely, if you know different things and you can share with your community, definitely share those resources.
Thank you. Thank you, Robena. Dr. Lee.
I think I would just echo what Robena said in that I think doulas provide a lot of value and they're absolutely underutilized and difficult, as she said, because of the wait list. But they provide a lot of support and encouragement to moms. For me, as a provider and even as a patient in the past, I'd say back to make sure you're getting your questions answered. You have to get your question answered. Make sure you're listening to your body. You're the expert in your body. I'm not the expert in your body. You're the expert in your body. Listen to your body. Don't ignore signs that when you know in your gut things don't feel right, and advocate for yourself to make sure it's investigated. It may turn out to be nothing, but make sure that it's investigated, and escalate concerns as you need to, and ultimately demand respect in your birth experience and afterwards.
Fern, do you want to move into your call to actions?
Yes, so why don't we talk about, and I know
Dr. Lee.
when I shared this video at another with another group, a lot of people felt helpless, or what can I do? What can I do now? Or how can I help? Well, that's why we want to share with you some of the things that you can do now. How you can make a difference, how you can get involved. as well as some resources that you can find out, even more. Do we have a slide on those, Devon? There is a bill right now in Congress, the Black Maternal Health Momnibus bill, active 2020. It's still on the House side. Please, get involved and contact your congressperson and urge that they act on this bill and actually move it and support it. What it does is deal with a very good job of the social determinants of health, and the impacts of discrimination and bias in terms of Black mothers. If you get online, you can read the components of that. So that's one thing you can do very easily, with a phone call. Support the Black Maternal Health Momnibus bill. The next thing that you can do, one of the things that you can do, is visit the website for the Department of Health and Human Services. For those of you that are not in Michigan, you still have a Health and Human Services in your state. Hopefully they do have some of the similar kinds of things that we have here in Michigan. But it's a very vibrant and active website with lots of great information and resources, ways that you can get engaged regardless of where you might live in the state. You see, they also provide access to the toxic video and other opportunities. So you can visit the MDHHS website. The person we work with, the Michigan, Dawn Schonefeld, she's on this call. So Dawn, if there's anything else that you want to put on the chat to remind people of what the opportunities are by contacting or checking out the website, please do so. The CDC, we've heard about this earlier, Hear Her campaign. They actually did a wonderful job in pulling together materials. They have posters, they have flyers, they have, handouts that you can display and use right now, make copies of and get started within your organization. And it focuses on listening, hear her. And as you can see from the video with Nina, a lot of the problems that we have and end up losing our lives or our babies is because we weren't listened to. There are many myths about African Americans and pain, that the health profession and many physicians believe that it's okay or that Blacks can stand more pain than white or don't feel pain the same way, which might be one reason why they don't respond. So Hear Her, a great resource, and we would suggest that if you're looking for something to just put in your hands, no matter where you live in the country, please check the website, the CDC website. There are some volunteer projects for those of you in the Detroit area that working with, that you can join in to work with SEMPQIC, with our agencies. So we're seeking Detroit residents who are willing to share their birthing stories. We will be producing some stories similar to what you'll actually see on the Hear Her campaign of some of our own women here in our community, their birth stories, good birth stories and not good birth stories. So if you want to volunteer to share your birth story, there's the website right here where you can get online and sign up for that. So the other thing that we want to encourage you to participate in is Sister Friends. Sister Friends is a mentoring program that's really sponsored by the city of Detroit. And we believe that it was very effective in helping get our infant mortality down. You only have to donate time, a little time, to call high-risk girls and offer support and follow up. So that's some of the things that you can do. And I think, Devon, you were moving to the next slide.
Yeah,
That
that's
when you click on this form, it'll take you to the survey and the evaluation, am I right? As well as how you can sign up and let us know that you volunteer share your thoughts on today's presentations. So that's another site. Devon, why don't you just explain those two sites, you or Dana?
Yeah, sure. I'm happy to jump in here. So our sign up form is just a short little Google form. There's a couple little questions on it. We're just trying to collect your name, your email, and if you're willing to share your story, or if you're not, if you know somebody who might be willing, and then if you want to volunteer for Sister Friends. This is for our Project Detroit Voices for Life project, which is funded through Merck for Mothers. Their Safer Childbirth Cities initiative. And then we just have a short little evaluation for you today to let us know your thoughts on how we did, what you got out of the presentation. So both of the links for both of those are in the chat, and they will get emailed to all the attendees tomorrow.
Right, because they lose the chat after we're off.
Mhm.
But you will get an email tomorrow that will have those two websites, both the survey and evaluation, which is very, very important. We really want to hear from you, as well as the opportunity to, to get involved in other ways. Just the last few.
I'm sorry, I just wanted to make sure I say something before we hang up. We're talking about
Yes.
mortality, and we're in the middle of a COVID pandemic. So I would be remiss if I didn't tell people that I very much support the COVID vaccination. I have seen a lot of illness and maternal death, unfortunately, over the past 15 months. So I would highly encourage folks to receive the vaccine in pregnancy. There's no effect on fertility as much as we know. And so I can't leave this panel discussion without putting in my 2 cents about that.
Well, thank you for saying that.
Dr. Lee, yeah, I was going to ask you to share that. I know that you mentioned in the chat, and I do believe that Dr. Iris Taylor put a link in the chat as well to sign up for COVID shots. So thank you for referencing that. Vern, did you have something else? I think you wanted to acknowledge.
I wanted to again acknowledge and thank the panelists, Dr. Lee, as well as Robena. You definitely added information, depth, and knowledge to this topic. We will share their resumes with you in that email, because we didn't tell you all about them, but we want you to know who they are and what they're doing in the community. I want to thank again our SEMPQIC team, Alethea, Carr, Iris Taylor, of course, Dana, thank you. Lisa Braddix, Devon, thank you. Andrell, thank you. And Jen Torres, who's our evaluator. And also Dawn, who's our state contact, who's a tremendous help to us. I want to point out that Shirley Gray, who manages the Sister Friend program, did put something in the chat. Somebody said the chat is downloadable. How will they get the chat afterwards? How will they access it if they want to?
They don't get the chat, we have the chat.
Okay, you don't get the chat.
We'll cherry pick the links and information, and we'll send them out to attendees.
We will cherry pick the links and information and send them out to you. So you'll be able to know what's there. We'll make sure you don't miss anything. We will also go through the questions that was posed on the chat and respond to those. Many of you did sign up for our newsletter. Some of you who registered did not sign up for the newsletter. But if you want to be in contact with us on a regular basis and know what's going on, we have some great things coming up, some meetings coming up, which will be in our newsletter in June. We're going to have a data meeting where we will really, I call it peel the onion off of the high level data that you heard. And for those of you that are clinical or in public health, if you're like me, you really want to know all of the questions and all of the answers. And we want to dig more into our reduction that we're so proud of Black infant mortality, to find out what exactly did we do to reach that. We had some new programs, City of Detroit provided transportation via doulas, and they have the Sister Friend and a program called Make Your Date. Our coalition members, as you all know, have been very, very active in working on solutions. We've expanded home visiting significantly during that period of time. So a lot's going on, but we want to narrow it down. We also want to make sure that we understand if there are any major clinical advancements, perhaps in 2019, that was hypertension reduced and make headway in diabetes, exactly what that was. So if you're interested in some of that, if you're on our, the state's website will also have it, I should add. And on our newsletter, we'll have the date for the data meeting. We have a meeting coming up with community organizations. That'll also be in our newsletter, and we'll be sharing that. So please keep in contact through our newsletter. You have our emails, and we'll try, and we know we keep the movement. We keep rolling. There's so much more work to be done. So much more work to be done. But we're all excited about how we can continue. We want to make the downward movement of 2019 a trend, not a blip. We want it to be a trend. And we know we can also reduce Black maternal mortality. Our Black mothers do not have to die. So thank you very much for attending. And we will be going through the chat and trying to pick up whatever we need to be sure that you don't miss anything. So Dawn typed out something. So Dawn, I know you added some additional information on the chat. And again, we'll go through it and send you some follow-up and be sure that everything is relevant on the chat, you'll get it. And we'll respond to questions. So good night. And thank you so much. Let's continue to make a difference. Let's save our babies and our moms. Good night.
Night, everybody.